And I think this is very important. When we think of the body, we basically think of what is a body that's at health. Well, a body that's in health or at health or expressing itself in a healthful way is one that has a good communication, within it. And you can extrapolate that into society. A healthy society is one that there's good communication. Husband and wife, the one that has a good relationship is one that there's good communication. Well, in the body, it's all about communication. A key element of that communication is through the nervous system. It's through the nervous system. It's not the only way that the body communicates, but it's a way that the body communicates through the nervous system. The way we break up kind of artificially, if you will, the nervous system is into three major categories. The central nervous system, which would include the brain and the spinal cord. The autonomic nervous system, which would represent the parasympathetic and the sympathetic components of it. And the enteric nervous system, or the intrinsic nervous system as it's tied into the gut. And we break them apart artificially, but they're really all interconnected. And that interconnection is very important. Okay? We talked before, and I gave a whole lecture on this idea of afferent, efferent, where we are basically responding to our what? Our environments. We're responding to our environments. Our external environment is through what? It's through our senses, through our various senses. You're hearing me speak, that's causing something to happen within you. You're seeing the surroundings, that causes something to happen to you. If you feel something, you palpate something, or somebody's touching you in a certain way, you're using your sense of touch to send information into your body. You then will respond to that stimuli at some level. Okay? So afferent is the information coming in, efferent is the response to that. Now it's just not a simple loop. If it was just a simple loop, everything would be what? Everything would be just like a knee-jerk reflex, and most of us don't exist that way, thankfully. Otherwise there'd be a lot more road rage and other issues going on. What influences that afferent-efferent relationship is what? What's a kind of thing that, all things being equal, that's going to determine how the body expresses itself efferently? The term I used before, I believe, was higher centers. Higher centers? Higher centers have to do with your thought processes, your pre-experience, your conditioning as you've gone through life, your attitudes, your biases, your thoughts towards things, your behavior towards things, your recollection into your limbic system. You hear somebody's name, does it bring pleasant thoughts and remembrances, or does it bring gastric irritation and nausea? Or something you visualize, you see something. Do you have a positive experience associated with that? Do you have a negative experience associated with that? Those are your higher centers. Some of them are within the realm of control, and some of them are not. Some of them got themselves buried up into the subconscious, and you might have to actually go after a cognitive type of therapy to readjust those thought processes. But the afferent-efferent relationship is altered by these higher centers that act in between. Okay? Our job when we work with somebody is to do what? To change efferent expression through what? Through manipulating the afferent experience. Right? So changing efferent by manipulating afferent experience. So the way that we interact with the person, not just the way we speak, the way we look, the way we talk, with that kind of thing, but the way we handle the person, physically touching the person, the way that we move them through a range of motion, the pressure of the touch, the temperature of the hands, the way that we integrate and interact with the person, all of that is afferent information. And we monitor, so we have a way of introducing afferent information, but the way we know how to modify or change the afferent information as it comes in is by what? Our observational skills. Through our senses, through our sense of touch, we monitor tissues as we move them through, say, a range of motion, using that example. Well, that's the efferent expression of what our afferent information is doing. We need to monitor the efferent expression of our actions and then change afferently what we're introducing into the system. And that's why you can't treat everybody the same way, because everybody has a unique afferent, efferent, modified by higher center experience. That's why each treatment has to be predicated based upon what you feel. Each motion, why did you go at this speed versus this speed? Why did you go through this range versus this range? Because tactily, perceptually, observationally, we're what? We're monitoring the efferent experience that that person's having. If we're moving something and everything getting tighter and tighter and tighter, and our goal is to do what? To loosen it, then maybe we're not doing the right thing. Maybe we're going to bring it tighter, 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 and then we're going to have a Golgi tendon organ stimulation, which will then give us what? automatic relaxation, okay, then at least you're monitoring it and you know. Or if you're going to use a long lever to rotate somebody through a plane, well, what determines when we have the forces vectored appropriately so the efferent experience is maximized? Our palpation. That's why it always comes down to the hands-on work. If you can't feel it, it makes it very difficult to do. Okay? So really this communication between you and the person, spoken or unspoken, is really strongly influenced with this afferent-efferent relationships. You should strive to try to understand this and look at how this feeds into that whole dynamic unity of the body. Okay? Look at how it structure and function, or anatomy and physiology, or form and function are interrelated at all levels. And the self-healing, self-repairing, it's tied into this. If you can unblock the channels that are acting to impede the normal healing natural process, then the health will be the result. It's not your job to make somebody better. Your job is to free them up so that they can become better based upon their own inherent forces. Okay?